Notice the left and the right image. In the left image, we are seeing a patient before the treatment for subcutaneous emphysema, and the right image is just taken after receiving the treatment. The left image patient of subcutaneous emphysema shows characteristic facial puffiness, the periorbital puffiness, the neck swelling, which can progress and go up to the groin itself. So let's go further and discuss about the condition subcutaneous emphysema. Hello everyone, so in this video we are going to talk about subcutaneous emphysema. This is the condition which is seen in more than 50% of cases of chest injury. What actually it is? It is the collection of air in the subcutaneous tissue from air in the pleural cavity. So following a blunt trauma or penetrating trauma, we have a rupture and the air pressure causes air to leak in the subcutaneous tissue, which is known as subcutaneous emphysema, that is subcutaneous collection of the air. What we actually can observe is rice crepitus or rice crypsis. As you are seeing these bubbles, the voice made after bursting these bubbles is the same voice which we hear in the case of subcutaneous emphysema. The swelling in this case can range from neck up to groin. Since here we have no compartment in subcutaneous tissue, this swelling can progressively increase going from neck to groin. The signs and symptoms include a patient presenting with neck mass or facial puffiness, dyspnea, breathlessness, and the patient with chest pain and neck pain. The diagnosis is generally clinical. We have many evidences on chest X-ray as you are seeing in this image. Let's discuss a bit about it. So as we notice this chest X-ray, okay, going against the conventional rules, we are directly looking into the specific changes, noticing the axillary areas of both the regions. So in the right region of the axilla, we can observe there are blackish shadows as pointed by this arrow. The similar shadows are not present on the left side of the left axilla, because there is no air. In this case, the patient had right side of the chest trauma, causing him to develop a right subcutaneous emphysema that is well documented over the axilla region as seen in the chest X-ray. Not so clearly visible, but in the right chest itself, okay, over the ribs, you can see these black shadows. These are also or can be the subcutaneous emphysema presentation, but we are not sure just by looking at the chest X-ray, because this diagnosis is most of the time clinical too. Okay, so these were some bits about the chest X-ray. Going further, so after discussing about chest X-ray, we already discussed about the causes that can be a blunt trauma or penetrating trauma in the chest. The treatment is generally benign. Okay, we need, if it is massive and causing disturbances like dyspnea and breathlessness, we have to give small cuts in the skin that are like stab lesions, and this helps in escape of the air and help in relieving the patient. We sometimes have to introduce a catheter in the subcutaneous tissue. So these were some bits about the subcutaneous emphysema. Thanks for watching.